We are now presenting the talk of Professor Vivian Lu. Professor Weeks, could you please introduce Dr. Lu?
Yes, good morning. And Dr. Lo is an associate professor in the Department of Social Work and Social Administration at the University of Hong Kong. She is also the director of the Sao Po Center on Aging, an honorary clinical associate in the Center on Behavioral Health at the University of Hong Kong, as well as numerous other roles in her capacity as a colleague at the University of Hong Kong. Her research focuses on long-term care, family caregiving, social adaptation, and mental health of older adults. She also has a keen interest in practice research on factors that contribute to the enhancement of mental health status. Her work has been published in journals including Aging and Mental Health, Family Process, Research on Social Work Practice, the Journal of Human Behavior in the Social Environment, and Social Indicators Research. Dr. Law is presently a member of the Society for Social Work Research, Hong Kong Social Workers Association, Hong Kong Association of Gerontology, and an international affiliate of the American Psychological Association. Thank you, Teresa. Please commence Dr. Low's presentation.
Hi, everyone. It's my great pleasure to present at a conference entitled Intervention and Prevention of Neurodegenerative Disease, Building Resilience. This session is session 4. My topic of today is dementia-friendly community, building resilience to prevent cognitive decline. I will cover 3 topics. The first one is why dementia-friendly community. The second one is action areas, in particular 3 areas that deserve our prioritized action, and then conclusion remarks on take-home messages. Why dementia-friendly? And according to the population estimation, Hong Kong is going to enter into super-aged society in 2024. And with another 10 years of time ahead, that is 2034, we're going to enter into an ultra-aged society. That means our population will be aging very quickly to reach 21% and 20% correspondingly. And according to the prevalence rate of dementia in Asia estimation, we all understand that when we have population reached 80 to 89 or even 19 and above, and the preference will be doubled and tripled as compared to those who aged younger than 80. So when we pair these 2 phenomena, that is the super-aged and ultra-aged society of Hong Kong and the estimated dementia preference rate in line with the age segment, we will estimate more and more people would suffer from dementia, and then they are living in the community. It is estimated by the World Report that the cost of dementia not only refers to the direct medical cost, but also direct social sector costs and informal care costs. And costing of informal care have a great impact on the total cost estimation. Supervision is a very important and significant part of daily informal care with significant opportunity cost for caregivers. Refers to a study that I conducted together with the HSBC and the TWF in Hong Kong. We find that the opportunity cost for employee is kind of very, very high. We're estimated to 4 times higher in 2060 compared to 2018. So in regard of that, if we look at the Global Dementia Observatory, there are 7 action areas that we should pay attention to on dementia as public health priority, on dementia awareness and friendliness, on dementia risk reduction, on dementia diagnosis, treatment, care, and support for dementia caregivers, information system, and dementia research and innovation. And I would like to highlight 3 areas for today's presentation. The first area I would like to highlight is on dementia awareness and friendliness. Since 2018, our government, under the leadership of Social Welfare Department, started the Dementia-friendly community campaign. And upon recent, over 15,000 people has attended the dementia-friendly education and become dementia friends. And this is a very, very positive mood in regard with how we can actually fight against negative stereotypes towards people with dementia, and also to achieve a better support to the caregivers. But according to our study in one of the districts in Hong Kong, we find that the dementia friendliness would be very much challenged by an observation on the perception gaps on dementia friendliness. First of all, if you look at these figures, you will find that for those people with dementia and the stakeholders and the publics, their perception on the dementia friendliness is different. For those with people with dementia, their perception of friendliness is the lowest as compared to the other stakeholders, including the caregivers, formal caregivers, and the other publics. So what does it mean? It implies that regardless of our effort to promote dementia friendliness and to fight against negative stereotypes towards people with dementia, including our primary care workforce, acute care, rehabilitation, end-of-life, social care, spiritual care, as well as our property management, market people, drivers, community leaders, we still have a gap in terms of what does it mean, dementia friendliness. If we look at the government campaign on dementia-friendly community, and it actually tried to enhance public understanding, to encourage care and support for persons with dementia and their families, and build a dementia-friendly community. But it's very unfortunate that after they reached the 15,000 attendance of Dementia Friends, the campaign actually not continued to scale up for a larger community. So the gap between this calls for more localized and continuous effort for us to target the most relevant stakeholders in the community. And I just give you 3 examples. Under the one of the dementia-friendly projects in one of the districts in Hong Kong, 3 stakeholder groups are targeted in terms of education, in terms of empowerment, and in terms of engagement and contribution. They are, first of all, the shop workers that work in the wet market, in the grocery, and also in the pharmacy, and in small shops, that canteens, in a community. So it is very important for them to know what does it mean, dementia, and also to greeting people with mild cognitive impairment, and even to report people at risk. The second segment or group of people that are very important is the security guides, because all these people, when they are live in the community, they will have their daily activities, go in and out of their household, and to empower the security people to understand the definition of dementia, the behavior indicators, and as well as the risks of people with dementia would be very significant. And in this district projects, we actually try to empower these security guides so that they will have more understanding on dementia and also help to secure people when they have some behavior indicators, and they will help the caregivers. And sometimes when the caregivers have some urgent needs, for example, to take care of the people with dementia for a little bit while, and they will invite them to sit in the eyesight area of the security guide so that they can actually help support the family members. And the third greatest sector is the committee of the neighborhood. So in some of our neighborhood, we have these leaders in one tower or one household buildings so that they can have a list of people that they will take care of and also try to linkage them with the outside resources. So with all the effort, we hope that the gaps between the people with dementia and other stakeholders and the public in terms of the friendliness of dementia can be decreased. And what are the most important things for people with dementia to enhance their sense of belongings? And first of all is their sense of security. I believe this is very, very important. If our society, our community become much more dementia friendly, people with dementia will feel much more secured in the community. And the second important, of course, is the sense of belonging, because people with dementia, they will gradually lost their understanding on social cognition, so that it is us, the people around him or her that can play very significant role to engage them and enable them to sustain their sense of belonging. And the last but not the least is a sense of significance. That means we don't want to push up a message that people with dementia are useless and they actually are lost all their capacity or capabilities to contribute. And we actually try to train them into the guides of the heritage places so that they can contribute to the community, and so that they feel that they are still significant to the community. These are the first action areas that I would like to highlight. The second action area that I would like to highlight is to call for actions in the community and also call for actions for health and social care professionals to pay attention to dementia risk reduction. And we understand that dementia is caused by multiple factors along all the life course, and the free education for children is considered as very important actions or interventions that would contribute to later life dementia reduction. And Department of Health in 2010 is an action plan to promote healthy diet and physical activity participation in Hong Kong. And also they advocate a multi-pronged approach to change the smoking behavior, which we consider as very, very significant and important. Of course, we also argue that in Hong Kong, the availability of guidelines for health and social care staff to manage dementia risk may not be consolidated at this moment. So it is also very important for us to join hands and develop that. And according to this life course understanding on dementia risks, you can see that actually we do have unmanageable factors in earlier life, in midlife, and also in late life that we should pay attention to. For example, in early life, as I mentioned before, is the education to a maximum of age 15. In midlife, that we should pay attention to hearing loss, traumatic brain injury, hypertension, alcohol, obesity. And in late life, we should pay attention to smoking, depression, social isolation, physical inactivity, diabetes, and air pollution. It is very important for us to take reference of these 12 risk factors because they are probably modifiable if we can pay attention to that, and we can make our society much more dementia friendly. But when we look at what works, we understand that maybe when we talk about physical inactivity, we have to pay more attention on the evidence on the aerobic exercises at moderate to high intensity. And also a rich social environment can moderate the relationship between APRO-E4 and cognitive functioning in a long-term effect. So when we look at how we can reduce the risk factors and going back to the evidences and also to enhance our health and social care professionals on the evidence-based practices would be significantly important. And last but not the least is the third area that I would like to call for action, that is to support for carers of people with dementia. We understand that the existence of dementia carer support services are there. For example, under the HA, we have smart patient website on dementia. We have elderly health services, the website on understanding dementia. We have dementia community support scheme under the Bureau. We have various funded projects by the project base, for example, the Carer Cafe, for example, Dementia Cafe, for example, Dementia-friendly community, for example, 656carer.com. But for me, my critical observation is that all these are very segmented informations. And if a person with dementia, his or her caregivers started to encounter the challenges that associated with dementia behavior, symptoms, and as well as the trajectory of the diseases, the carers will feel lost in all these informations, and he or she may not have very sufficient competence or literacy to make right decisions so that she or he can put up their carer support in a more constructive and variable way. So it is very important for us to understand how we can assess risks, how we can understand that only multidimensional carer support can be effective to support the carers, and the care management approach in supporting caregivers might be one of the ways that we can introduce to families, even introduce to families that hire domestic helpers to support their people with dementia at their own home. And of course, all the dementia care could be a very long journey. So financial support or benefits to protect the dementia caregivers is as well a very important area for us to pay attention to. Our pilot scheme on living allowance for carers of elderly persons from low-income families, phase 3, has its own merits, but also has its limitations. We might wish to revisit it and also to make it more dementia-friendly in the future. And our center has tried our very best to understand how we can translate the best practices into a local context. So back to a few years ago, we have translated the evidence-based intervention that called REACH and into the Hong Kong context. We have published a paper on multi-component intervention on enhancing dementia caregiver well-being and reducing behavior problems among Hong Kong Chinese. And we also published correspondingly 2 booklets. One is a booklet for caregivers and one is a booklet for practitioners' manual for good practices in dementia caregiver services in Hong Kong. This is the first attempt to translate an evidence-based dementia caregiver intervention developed in the US to the Hong Kong Chinese context. And we understand that a very individualized intervention based on risk appraisal or risk assessment plays a key role for us to achieve a very sustainable support to dementia caregivers. So we are very honored to further develop this into an app. We called it Reach Hong Kong Smart. And this Reach Hong Kong Smart enabled our formal caregivers to engage our informal caregivers in a non-stop way so that they can join hands and no one would stay lonely, so that they can have a learning community to work out their solutions and also to receive very good support. So my take-home message today, first of all, we want to engage all sectors or advocate that all sectors join hands to build up a dementia-friendly community in Hong Kong is extremely important. It is not only the healthcare professionals and the social care professionals, it actually deserves effort from the employers, from the shop workers, from the drivers, from the security guides, and all of these sectors should join hands so that we can make dementia friendly. And then we should focus on amendable risk factors from a life course perspective. That means to introduce intervention only at the old age stage may not be sufficient for our own society to fight against dementia and also to make us more resilient in dementia. It is important for us to pay attention to amendable risk factors from the very beginning, that is the education, to the mid-age, then moving into the old age stage. And last but not the least, and we must support family caregivers and use family as a unit of intervention so that our support to people with dementia could be more comprehensive, more systematic, and more impactful. Thank you very much for listening to my presentation. If you are interested in more of dementia caregiver support or dementia friendly, please feel free to write me an email on wlou@hku.hk. Thank you very much. It is really nice to have you with me in the moment, and then welcome to join me at the Q&A session. Thank you.
Thank you so much, Dr. Low. I'd like to take this opportunity and welcome to acknowledge the incredible work that Dr. Low has done. It's come across in the presentation, but I really want to reinforce it because this grassroots approach to dementia care, including carers, is really due to the work of Dr. Low and the Southpole Aging Research Center. And I think you can see how in Hong Kong, the grassroots approach has been so successful. It's a unique aspect. I'm in London. I've been in the UK for some time now, and I've become more aware of what happens on the ground in other countries, including Australia. But I must say that the work of Dr. Law, as you've seen, is really exceptional because of the willingness of community groups in Hong Kong to support families, but also communities in Hong Kong in a way that I think is really important, for an important lesson for the rest of the world, and reflects the way that the policies in the GBA should be illustrated and showcased. And I'm so grateful we have a rare treasure this morning to address this in more detail with questions and so forth. So if I may just open up the floor to questions. We do have some questions. And I would also just quickly point out that this afternoon we will reinforce a great deal of what Dr. Law has said from the UK perspective, particularly Professor Linda Clare, who will speak about very similar issues from the Welsh as well as the English perspective. And certainly the IDEAL study that Dr. Law will be aware of is one that I think we can both learn from reciprocally moving forward. Now, the first question that we have here, which I would like to put to you, Vivian, if I may, what do you believe are the challenges to reduce stigma towards aging and dementia in the Greater Bay Area?
This is a very important question. I think there's several levels of stigma there, or maybe dimensions. One dimension is the positive and negative stigma. So I think now we are moving towards a more, we call it compassionate stigma. That means we love these people, we want to support them, so that they were perceived as very weak, without capacity, and also need support and services all the time. That's why, you know, in our carer survey, over each time in whatever sample you draw, and for the dementia care, people would say, oh, I take 24 hours to take care of my parents, my spouse, because they are demented people. So I think this is kind of fall into a trap that we believe that these the people with dementia, they're totally dependent, and then they need our 24 hours. So for me, this is I would call it compassionate stigma. That means we tended to say, I love them, I care about them, and then to put them into a very disadvantaged position. This is a very fundamental issue, deserve our attention, maybe more research on that, and also our reflective capacity among our professionals to fight against that. But at the public level, I would say in the past 5 years of time, there are more and more acceptance from the community, because there are more and more people they have daily activities in the community, so that they become much more visible, and the people are started to understand, oh, this is dementia. And I would attribute a bit to our government's Dementia Friends campaign, that in alliance with the UK initiative and the global campaign, and more and more people start to understand that. But I think at the behavior level, it is the gap, as I pointed in my presentation, the gap between, you know, people with dementia, caregivers, and the stakeholders. Stakeholders believe, oh, after I know that, I become friends, and I'm really friendly. But the gap is the people with dementia and their caregivers will perceive, oh, no, you're not friendly. You know, this is not a friendly. So the more work has to work on the gap between these group of people. And of course, in a professional perspective, I think there are far less sufficient training for all the healthcare professionals on dementia. I have run 2-day workshops for our BSW students last year to let them know what is dementia and what are the services there and how we can fight against these stereotypes and this and that, because they have 0 hours, almost 0 hours in their training. So this would be a very challenging one if we are going to recruit these professional graduates to serve people with dementia in the community. Yeah, thank you.
Yeah, and I think if I could just chip in that for speech therapists, I trained speech therapists in Hong Kong for over 10 years, as well as clinical psychologists back in the 90s, but that's another story. The questions of the conference so far that we've emerged in screening for hearing loss are really relevant to our students. And I think this ought to be a priority for training of speech therapists in Hong Kong. Another question we have here is relevant to the public policy in Hong Kong specifically that you refer to often. Can you give us some examples of policies that are designed to reduce the burden of dementia on carers in Hong Kong? And as you're speaking, it would be helpful, I think, for the audience to understand the context of carers. We have seen in your presentation the enormous support from community as well as family, which is, I must say, a unique feature of Hong Kong. But of course, we also have carers that have an official or a specific duty in the management of the burden of dementia. Could you comment a little bit upon that?
I think for the carers, we have 2 segments of carers. One is formal, one is family. We call it informal carers. And on the formal side, actually Hong Kong, the residential care facilities, our government has a policy. They call it a dementia supplement. That means they will do a snapshot survey on how many residents in the long-term care facilities their diagnosis or suffer from dementia. And based on that percentage of residents who suffer dementia, so that they would receive extra financial support from the government. So that they can use that resources to hire more human resources, and also maybe to equip some software, hardware, so that they can have much more better support to the people with dementia. And then recently we have this German Technology Fund. And then I understand that quite a lot of residential care facilities, they use that fund to either to develop or to purchase some of the technology supported solutions. For example, the alarm systems, and even some tracking systems, or even some night bed monitoring systems, so that they try to equip that, so that to relieve the burden of the formal caregivers in taking care of people with dementia in the residential care facilities. And I myself did a small scale research on bringing the social robots to the residential care facility residents who suffer from dementia. I didn't know, it's in 7 residential care facilities in Hong Kong, and then we did an experimental design, and we found it actually can contribute to relieve the burden of the formal caregivers, and also as well to enhance the quality of life of the residents. It is a Japan made human door or social robots, and it was designed to be 3 years old, and it's very small, and then it's a very independent door intervention. That means we don't ask the formal caregivers to play the door, to engage the door with the residents, just give the residents so that they can actually have their natural interaction with the door. And then we find it's quite interesting. It has been also a published paper on that. If you are interested, I can send you that. This is on the formal side, but on the informal side, we have carer allowance for families who have living difficulties. And also we have this community dementia support scheme. Then we will stratify the family caregivers into two groups. One is under high stress, high burden, one is in a low burden, so that we will actually direct the appropriate training and empowerment services to those who are under the high burden. But I think the challenge here is because the program only lasts for 6 months. So we don't know how after 6 months, we all understand dementia is a very long life disease trajectory. So there's no way that we can actually support carers for 6 months and then let them back to the community without any challenges. It is almost impossible. So the sector and the government is working very closely on the follow-up solutions, how we can actually better support them in a very long and continuous run. But of course, we in Hong Kong, dementia has become a very hot topic, and we have very innovative groups, the community groups, including I have been a research partner of a group called Big Silver. Now they have a very active group on, they call it Carer Voice. They have a Facebook channel, they have their own post, and then they do drama, and they do quite a lot of advocacy work from the grassroots. And they play quite a significant role in Hong Kong to further promote and advocate rights of dementia caregivers.
Thank you. Now I'm going to take this opportunity to invite Dr. Carteri to come on, because Teresa is in fact from Sao Paulo, where I visited many times, and I noticed some similarities in the way that older people are taken care of in the home between Hong Kong and Sao Paulo. And Teresa may have specific questions, but I would like Teresa to share with you some of your joint experiences, as Teresa's been in Hong Kong for over a year now, so she's aware of what happens in Hong Kong. I'm very fascinated to get that comparative perspective. Teresa, could you take the floor?
Hi, Dr. Low. Thank you for your wonderful presentation.
Thank you.
Yes, some similarities is we have a low level of institutionalization in Brazil of the elderly. We have a strong commitment of the family with the elderly, but it affects a lot the carers. The burden on the carers is very, very, very high, and they usually have to abandon their professional activities to take care of the elderly person, and this has also an impact on socioeconomic status. So I think the experience, I would like you maybe to comment on how could this be feasible in contexts where the socioeconomic status is not so high and the policies are still being developed to address this problem, because this in the end may increase the stigma again of dementia and aging in general.
Yeah, I think this is a real challenge. You know, in Hong Kong, we definitely have to attribute part of the feasibility to the domestic helpers. because without help from domestic helpers, a lot of families, as you mentioned, the family caregivers, they have to quit their jobs and then move into a full-time caregiver, in particular to take care of a person with dementia. But we all understand from a global perspective, many studies has support evidence that it is definitely a better solution if we can keep people in the workforce, but at the same time support them to take care of family members. From my perspective, I think the only pathway, or maybe the only possible pathway to achieve that, is to work out a comparatively or sustainable community solution. And in Hong Kong, we have several initiatives that might be worthwhile consider. The first thing is that maybe, you know, if the community, the neighborhood is very friendly, they know each other, maybe they can become a supporting group so that people with dementia can be supported in that way, right? In Hong Kong, because of the modernization processes and also the high-rise buildings, and it becomes less and less possible for the community to achieve that. But still, we do have some community projects supported by the community engagement and inclusion fund, so that they have this mechanism. They called it the 老长, the champion of the building, right? So many often this person will be identified, and he or she is responsible for the whole building. In particular, of course, responsible for to take care or providing support for those vulnerable residents in that building, so that he or she would have a clear understanding of who they are, who these vulnerable residents are, and then what time they might need help, and also then to compare the possible volunteers so that they can actually achieve that. So I'm now working with 5 NGOs to work on the nurturing of the elderly sitter program in Hong Kong. And most often these elderly sitters, they're going to do home respite. That means if you don't have a community respite centers for people to drop in and to use that services, you can actually train the volunteers to achieve that goal. If you have 3 hours in need, and then you can go. But of course, I understand this will bring a lot of challenge for these the family caregivers. If they work full-time, if their work is very labor intensive, if they have to be on spot, you know, during their employment, these would be much more challenged. But at least we can support some of the family caregivers to achieve. Maybe they can be more flexible so that they can work half-time or whatever. So these are I think the community support or the neighborhood support is the most important things. And of course, to train or to bring preventive intervention for those who suffer from early, we call them out, cognitive impairment, would be another thing that we must pay attention to. So if you started to be aware that you are suffering from cognitive impairment, you should do a screening, do a test, so that you can actually review your lifestyle. As I mentioned, that there are quite a lot of midlife risk factors. You might could do a screening test, and then you change your lifestyle, and to see how this could be helpful in the long run. Yeah, thank you.
Thank you.
Thank you. And I have another question from the floor. Outside of Hong Kong, people won't be aware of your work with the media, Vivian. And if you could just give us a synopsis of your activities, particularly surrounding the pandemic. And you've had quite a lot to say that I would like to share with the audience. Could you just give us a brief sketch of your engagement with the media?
Mm-hmm. Yeah. You mean under the pandemic?
Yes, I think specifically, I am aware of your comments lately and indeed presentations that are available online for those who would like to look at those.
Oh,
and you know, the types of issues in the media surrounding care and COVID in the context of dementia.
Oh, I see. I know what you refer to. Yeah, under the pandemic, I did a small scale of research on, you know, how the media respond to people, you know, in general, the older population in Hong Kong, and we found that the ageism is quite obvious. And not only the negative ageism that use older adults as an example to illustrate they did not follow the instructions, and they are very, very vulnerable. And even, you know, our government video about the older adults under pandemic is kind of not that proactive to fight against ageism. And to that extreme, we called it compassionate ageism. That means our media will report that, because we are so loving our older adults, so that, you know, they should keep at home. They should they should not go out for shopping or grocery. They should follow this. They should do this. And as a young generation, we should this and that. So that we find it's quite in the trend in terms of looking at our older adults as a very vulnerable group, and not give them sufficient credit that they have their resiliences, they're working very hard. And in fact, I have running quite a lot of projects with our community partners, and we found older adults are very eager to learn. I think at the very, very beginning, in the first 3-4 months, and they're shocked as everyone, you know. But after that, they approach us and tell us, "Oh, would you please tell me how to use the Zoom, how to work out the solutions, you know?" And then some of them even told us that they are now willing to pay the service fee for the Wi-Fi at home. And before that, they don't do, because they consider, if I can go to the elderly centers, they can get access to the Wi-Fi. But after the COVID, so my view is that we should not rule out and also to discount the resilience of our older adults, and of course, as well as our family members. If you are be aware, actually, our family members have become quite vocal during the pandemic, and even they challenge, you know, the professional workers on why did you shut out the services, and how we can work together to find out the solutions, and this and that. They're very vocal, in particular in the social media. Yeah.
Yeah, I think this issue of ageism is something that we have to deal with around the world, but it's interesting that the responsibility for the pandemic is placed on individuals outside of the cultural context in a very unfair way. And I think this is a very important point to make. Of course, we want to shield the vulnerable, and many countries have done that successfully, but including Hong Kong, I must say. But there is also a compulsion to judge the capacity of seniors in a way that's perhaps a little bit unfair, I think.
Yeah.
Of course, we could make the same comments about the young. It's a difficult time for everybody, but I'm pleased that you're doing so well in Hong Kong with the management of the pandemic. Now, I'm going to ask if Bill is available to just join us briefly. he may be taking a break. It's lunchtime. I don't see him there, but I will pass to Adam, and who has joined us. Adam is in Shenzhen right now, and he will take over as host while Teresa has a lunch break. Adam, did you want to introduce yourself and perhaps ask a question from the context that you're in right now, the Greater Bay Area, and extending into Shenzhen?
So I'm Professor Week's PhD student, currently located in Shenzhen. And I guess I'm interested, and I apologize, I was actually coincidentally getting tested for COVID prior to joining the session. So I wasn't following in real time, but I am interested in terms of, the GBA is very unique. So I come from America, we are quite diverse, but the region of the GBA is very, very different from what I'm used to. And understanding the unique features of mental health, the impact of different risk factors and these other variables on mental health outcomes in the GBA is very, very interesting from the outside perspective. What do you think are the biggest differences between what we see in countries that are diverse, such as America, but perhaps not as diverse in a different sense as the GBA? What makes the GBA unique when it comes to the area that you and a lot of the other researchers, including Dr. Chang, study?
GBA. I have to confess that I haven't studied GBA in particular. I did a few work with people from Guangzhou and Shenzhen, and which I found that they are much more close to Hong Kong. But for all the other areas, I'm not familiar with. But based on my experiences, I would say in terms of dementia or dementia care in the community, I'm not quite familiar with the healthcare system, but just in the community, I would say, it's far less be aware of that. Maybe we are still affected by the culture that aging or become less cognitively smart or alert is a normal aging process. It's just like in our Chinese, 老来糊涂. It's just normal. So people don't pay much more attention. But at the same time, I would say the caregivers become much more and more alert, and also due to the first batch of one-child parents, one-child family parents will reach to, I think now they're probably reached to 70s, and then in the coming 75 maybe, in the coming 10 years of time they're going to reach 85. So I think there's still 10 years of opportunity for the Great Bay Area families or policies or social services to catch up, because we all understand dementia is age related in terms of prevalences and also the trajectory. So if we look at that, there's still a bit of windows there. People can still work on that, and also to work out the solutions. But to my best guess, if we want to work that out in the Great Bay Area, it is really not, Hong Kong is not a very, very close relevant model to follow, because we have established a very well elderly services network in the community, because now we have over 120, we have 121 neighborhood elderly centers, 41 district community elderly centers. But in the Great Bay Area, except I think for Guangzhou and Shenzhen, or maybe Dongguan, and for all the other cities and towns and areas, they don't have such an infrastructure to support the community. So if there's anything we want to advocate or promote, I think first of all is to work out the technology supported solutions for those who maybe suffer from earlier signs or this, and to support them to do self-assessment and self-risk identification so that they can work out solutions by themselves first. And then for the severe cases, maybe the daycare centers could be one of the solutions for them, but not that optimistic, I would say, because in that area, there are quite a lot of families. Their family caregivers may be remote caregivers. They're not living in the same city or same household. They're remote caregivers. So if after 10 years of time, they only have one middle-aged child, and then that becomes the two pair of parents, one pair of middle-aged adulthood, and then they might have two children. And now, because of the relief of the new population policy, they might have three children. So it becomes a very challenging family structure, and also the demographic in the coming China. So Great Bay Area is also one of the areas that we might need to work out the infrastructure first. I don't see there's any very well-built infrastructure at this moment. Thank you.
Yes, and not to go further in, but even within Guangdong, there is a huge amount of diversity in family structure. So if you go east to the Shantou and the Shaoshan area, those families tend to already be pretty big, where they've got more people than you would see in the typical families in Shenzhen and Guangzhou and other cities that are in the Pearl River Delta. So very, very interesting. And thank you for providing me the opportunity to ask you a question kind of on the spot. I'm now going to pass to Professor Weeks, who is going to close this session and then open our next session.
Thank you, Adam. Yeah,
I'm very delighted to thank Professor Wang and Dr. Law for their incredibly useful and helpful presentations this morning. I do have an announcement, which is that we have an extra presentation which will come up now from Dr. Wu, who was referenced in Professor Brain's presentation, an epidemiologist who has been working on prevalence and incidence of dementia in mainland China. Dr. Wu has kindly sent us at the last minute a pre-recorded talk. So please stay with us over the lunch break to view the talk, and we hope that Dr. Wu, who is currently also in London, will join us for Q&A later this afternoon, together with Professor Claire and her team. And we'd invite Dr. Law to come back if possible. I know that your demands are high and you may not have the time, but if you can, please do come back for the Q&A. We really enjoy seeing you again. And also Professor Wang, if you could come back, we'd be very, very pleased to see you again. So please join me in thanking presenters this morning and Professor Karen Anstey as well for kicking off the session and giving us a context to build on today. Thank you so much, Vivian.
Thank you. Thank you. Thank you.